So.
All right, well, I'm Katherine Fernandez.
And I'm Alex Fernandez.
And we are the owners of the Cosmetic Wellness Institute. And very exciting venture for us. We're going to tell you a little bit about how we ended up here.
Yeah, it's been quite a journey.
Indeed.
From pediatric urology from me in vascular surgery to opening up our med spa.
I know.
In our front room.
Yeah.
In our house 5 years ago.
4.
4? Okay.
Yeah, 4 years ago.
4 years ago.
To this. So yeah, now we have this from then a room, and then 2 rooms, and then a big space.
Mm-hmm.
And now bringing on another team member. It's all very intimidating and scary. But, it's an interesting journey because, I'm a PA. I've been a PA since 2002. And I wanted to do pediatric urology because that's what I did before I went to PA school. I was the lowest man on the totem pole in the clinic, but I really liked it. It was really unique. And so after I graduated, I got a job right out of PA school doing that and loved it. And probably would have continued doing it, except that my mom got sick with ovarian cancer, and that made it really difficult to keep up that type of schedule.
And you met me.
And I met him and thought someday we're going to have kids and get married and have a life that doesn't only involve medicine. So then that caused me to change, and I did veins for a long time, which was also super cool. Meanwhile.
Yep, I was a general surgery resident when we met. Talk about being the lowest man on the totem pole. 6 years of general surgery, 2 years of vascular fellowship, and then 10 years in private practice in North and South Carolina doing vascular surgery until COVID, which just burnt me to a crisp. And then somehow got into hair and hair restoration, and did that for 6 months with one of the best hair transplant surgeons probably in the country, or actually in the world. Things didn't work out there, and I opened my own practice in one of those small rooms that we had, and then this space came up. We spent a lot of money renovating it, and now we've been here for over a year, and doing just a little bit of everything, but our identity is about taking care of people as individuals and not just one aspect of it. And this is where we've evolved over the last 6 months to a year,
Mm-hmm.
to where it's been not just focusing on weight loss or aesthetics or Botox, to really just the concept of medical wellness as a kind of a radical concept for us, because we've always been in sick care.
Yes.
And now thinking more about preventing illness and disease, and what can we do for our patients that is going to be good for them now and good for them 10, 15, 20 years from now.
Yes, and I grew up with the idea of, we always took supplements. My parents, we had a all-natural house, is what my mom would say, and I didn't even have a chocolate chip cookie until I went to grade school, because we only used carob. And always put wheat germ on my yogurt and put honey in my cereal. I did not know that all these other things were even out there. And so it's funny coming full circle, kind of doing this now. I always liked the idea of wellness, but I was trained in healthcare, which I've now figured out. It's kind of like looking through the opposite ends of the telescope. We were trained in sick care. If you have a disease, then we fix you. And that's just not the way the body works. And so it's more difficult to keep people healthy that way. So this approach of wellness, of truly preventing things and making sure that everything is there that your body needs to do what it needs to do, just allowing it to do what it's naturally going to do, always keeping an eye on, are we straying from the path? But starting with Botox and spider veins, that's how this whole thing started. Was I left my practice veins because after COVID, I decided that I was going to homeschool my kids, which is insane if you knew me. We all had to homeschool our kids for the first few weeks when COVID hit, and I had a first and a second grader at the time. And I thought, this is really fun. I like this. So I quit my job and homeschooled our daughters, who are now 12 and 13, for a full year. We just did that. And then people were calling from my old practice to find out if I was still around and if I was still doing spider veins. So that became the idea that, oh, okay, well, we could do that. So that's the front room of our house. I'll do that. Just people I know. And then, people like Botox. Maybe I'll go and learn to do that. And when I went for the training for that, it was just way more involved than I thought. And I found I liked all of this other stuff too. So it started with aesthetics, but thankfully the person that trained me, Dr. Joni Collins, she is very into wellness and emphasized that first in the consultation and everything about it. It's all about keeping your eye on the prize. It doesn't matter how good your Botox is if your skin isn't in good health, and your skin's not going to be in good health if your gut is not in good health, and so on and so forth. And so always keeping that in my mind. And then when the weight loss epidemic started, when we were able to get compounded medications and things, that changed. And I really was like, we're not doing everything we can. I'm just doing this, and really wanting to figure out, why are you eating when you're not hungry? What's really happening here? Not just what's happening here, but what's happening here. Because, weight loss happens here. The results are here. So really digging down into that, and then that naturally led to hormones, which I am going to be 51 in 2 weeks, so
and I will be 49.
So that's been a concern, and my mom died of ovarian cancer, so I had my ovaries removed, and that put me automatically in menopause. And I also had breast cancer, so there was some concerns about me taking estrogen, which I was going to take no matter what, but wanted to be safe because he cares about safety.
Yes, I did.
And went down that road and was able to do all that, and had a mastectomy, did all that. I'm 5 years out from that. But figuring out how important all of these things are, just everything. You've got to have everything in place to age well, right? If we're lucky enough to get old, then what's that going to look like? What's the next 30 years going to look like? Is it going to be vital, active, getting out, doing things, feeling good, understanding that time happens? Or am I going to be sitting around, not feeling well, not able to engage, not able to go for walks and
just be an active participant in your own life.
Right.
Essentially.
And so the way to do that is to get ahead of the game.
And it's funny, this whole evolution into hormone replacement therapy, Katherine's been wanting to do that for a long, long time, and I was just not a fan. In fact, I thought it could be potentially very dangerous, that we'd be opening ourselves up to a lot of potential liability and risk. And this just demonstrated how we were all kind of indoctrinated in medicine about you don't mess with certain things, and the way that I was taught, this was like anabolic steroids, and it had a bunch of risks, and and even as a vascular surgeon, I saw patients who would develop like blood clots and have issues from what I thought was just testosterone. Come to find out, it was not just testosterone. It was actually steroids and growth hormone and supplements that may not have been, really tested or, have any safety parameters, and that's what ended up causing those issues. And then Katherine insisted for probably almost a year or more about doing this.
I kept bugging him.
And finally we're like, okay, fine, there's this great course in Dallas, and we went, and it was absolutely transformative to how I think about the practice of practicing medicine. One of the greatest things we learned, and I use this term every day, is that normal is not optimal. And for What are you laughing at, lady?
Oh, are we going to talk about my hemoglobin A1C?
No, we're not going
Yes,
there
we are.
because
We are.
maybe at a different point. But where this really came into play, and this is going back to what Katherine mentioned about we were missing something, and I've started using this a lot with my patients, is if we think about a chair or a table, something that has 4 legs, and we are building on top of that foundation, we've always been focusing on maybe 1 or 2 legs, not realizing the vital importance of the rest of those legs in terms of creating that very strong foundation that can serve for 20, 30, 40 years down the line, and focusing on thyroid hormone, estrogen, testosterone, even in women, and nutritional balance, supplementing the nutritional deficiencies which are rampant in this country, and the dramatic impact that this can make on our patients' immediate and long-term just quality of life. So once we went to this course and our minds were totally blown and we brought this back home, we got on we've had our estrogen, or I have not. I've had my testosterone replaced. Katherine has had her estrogen and testosterone replaced.
And progesterone.
And progesterone.
Let's not forget.
My bad.
Yeah.
And it has been an incredible journey over the last 8 to 9 weeks to see how we've evolved, or how we've changed, and then realizing, wow, I didn't realize how bad I was.
I did.
Of course you did. But realizing that, and I thought, well, this is just the way it is. I don't want to mess with how we were designed, and realizing, no,
This is not normal.
Well, it is normal, but it doesn't have to be that way.
Right.
In terms normal being the biologic process that gets us to this point in our lives, in our 40s and 50s. But realizing that we can do something about it that is safe, effective, and life-altering.
Oh, yes.
In many different aspects. One of the first ones that we've suffered with for a long, long time is our sleep quality, which, having been an insomniac and a surgery resident, I haven't slept well in 25 years at least.
Yep.
And now I'll wake up, I'll go to bed, and I will sleep through the night, and the incredible change is waking up rested, actually feeling like,
Oh, I got a good night's sleep.
So this is what what other people must feel like.
Right, because we don't know.
We don't know.
I'd forgotten.
Yeah.
Yeah, it's, and for him, seeing what testosterone does, right? Because if these changes happen abruptly, like they did for me, then you would really notice it. It's the idea of the frog, right? You can boil a frog. If you just turn up the water tiny little bits, it won't go anywhere. But if you put a frog in boiling water, it will jump out. But we don't notice that slow change over time until all of a sudden something's really wrong. And then it's like, oh, well, maybe something's wrong. And for men, it usually starts with erectile dysfunction. That's the first sign. I'm like, no, the problem's been going on for years before we get to that point.
Yep.
But the sort of, it looks like depression in some men, and just that feeling that just can't quite.
My get up and go, got up and went.
Right.
So
and, women expect menopause. We talk about it. We talk to our mothers about it, our cousins, our aunts and uncles. Our aunts, not our uncles. But we are prepared for that, and know it's coming, and there's that, it's scary, but many of us have forged that path, so we know what to do. But men, they go through andropause, but it doesn't really get talked about as much. But it really looks different. And looking at, now we study everybody's lab reports, like forensic doctors. We're like, oh, wait, maybe we can predict this is going to happen in 20 years. But looking at these normal ranges that are on these, like the range for men for normal levels of testosterone is 200 to 1100.
Yeah.
in some labs, 200 to 900. Okay, so the people at 200 are having a completely different life than the people at 900. And so, but like all of that's normal, but none of that's optimal. And so, and for women, those numbers are very low too. And what we're finding with, you know, pellets, which is our primary source of testosterone replacement, have been going on for a long time. These were really popular in the 30s and 40s, and then it changed once the birth control pill came out and we could make synthetic hormones into pills. But there's lots of studies back then that these levels that we establish as normal now, they knew back then that those levels were artificially low. And the same for thyroid. Some of these normal values that we're like, well, this is normal, but I don't feel good. So if it's normal, then maybe something's wrong with me. And I think a lot of women get in that situation where they think, well, it's menopause, and you know, menopause has a terrible reputation. What am I, maybe hot, fat, and crazy? I mean, no one wants that. I didn't want to sign up for that. I'm already hot all the time anyway. I don't need
the nuclear reactor.
I am the nuclear reactor. And so it was really amazing to see that we could really make a difference. You know, like that adding hormones and wellness, not just that, like, oh, look, your vitamin D level is really, really low, and that's really, really important for you to have that. And making sure that if people are taking supplements, a lot of people come in with their bag of supplements, and I'm looking at all of these and thinking, okay, so if you're taking this and this together, they cancel each other out, so don't take those at the same time. Or this needs to be taken in the morning, or this needs to be taken with food, this needs to be taken without food.
With fat for better absorption.
Or on an empty stomach for better absorption. And like knowing these things, and people, there's so much information out there, so people are like, oh, well, this is good and that's good. And so we just throw it all in the pot and then don't get where we want to go. So it's really exciting. Like,
yes, it is.
Very exciting to do all this. And so, you know, when I've got someone maximized, right, I've got them on their hormone pellets and their estrogen and their progesterone. So then when I go to do my pretty stuff, my, you know, non-surgical facelifts and lasers and all of these other things that we do to make you look pretty here, they're going to heal faster, they're going to have longer lasting results, they're going to get way more out of their money than if I didn't do that ahead of time.
Well, they feel well, then they look well,
Yes.
and it's just that complete package, essentially, as opposed to, oh, we'll just focus on looking.
Right, we're just going to do your Botox, but totally ignore the fact that you've got these brown spots on your skin, and or that your skin quality is really low because that's too expensive. Let's just put a Band-Aid on this, you know, wound.
A Band-Aid is what sick care, you know, what we've been doing for 25 years that we've been in medicine. It's been just barely keeping people going,
right?
As opposed to, how about we stop this vicious cycle, make a impact that can be long lasting and have effects down the line. You know, I was amazed to find out that with estrogen and testosterone replacement, we could drop all-cause mortality, decrease the rate of heart attack, stroke, diabetes, osteoporosis,
Dementia.
Alzheimer's,
Yeah.
especially in women.
Especially women.
I mean,
Significant.
wow, like, where's this been?
Right. And there's the fear, you know, the breast cancer question, right?
And that's been
5-year breast cancer survivor right here. And my grandmother had breast cancer, and my mom had ovarian cancer. So there was all these concerns, and the big WHI study, World Health Institute study, came out in 2002, and it was a Time magazine front cover thing. What are hormones doing to you? And I was in PA school at that time, and it was a hot topic. Everybody was talking about it, and this whole idea that, you know, that all of a sudden that estrogen, and it was estrogen, is how it was. That's how I understood it. That estrogen was causing breast cancer, and so all these women that were on hormone replacement therapy needed to stop their medicine, or else risk having cancer. And some of those women did stop their medicine, and some of them didn't. But this got imprinted into the American psyche that estrogen causes breast cancer.
And also in medicine. Let's not
Like,
forget.
it was,
it's like all of a sudden, whoa, wait a minute.
Black box warning, like, don't do that.
You can't do that anymore.
Right, so if you had breast cancer, sorry, you're just gonna have to be hot, fat, and crazy. And that's been the line. And but now really that study never said that. It was the synthetic progestin, not progesterone, but progestin that produced the breast cancer risk. And there's really no increased risk with non-oral estrogen, that means cream, patch, pellet, in breast cancer, or in any disease process, actually. Because it's bioidentical. We're supposed to have it. And I saw something recently about a woman saying that, from a purely evolutionary standpoint, a biological standpoint, it makes sense that we go through menopause, because would I want to be having a baby at 50? No, thank you. And that doesn't make sense. There'd be no way to raise the child if you look at this from purely a scientific standpoint. And so the body begins to degrade, the brain stops sending signals to the ovaries to do anything. And also all of those as the estrogen goes down, we know the things that go with that. Your risk of osteoporosis, because again, the brain doesn't send signals to the bone to stimulate these things, because you're winding down. But we're routinely, the life expectancy continues to go up, not down, and we're living longer without these hormones. And so we're suffering. We're not as happy as we could be. We're not as fulfilled as we could be. And it's a big disservice to women. And men have actually fallen into this category too. But women in particular have sort of been, it's menopause, just get over it. And here's an SSRI, that should help you. I know you're depressed. I can't give you estrogen because it might cause you breast cancer. Or I don't know, I just don't feel comfortable with that. But I can definitely give you some Prozac, and you're gonna feel better, and you'll get through this, the hot flashes will stop, and then you'll feel better.
And then your hair thins.
And your skin doesn't look as good. Your hair thins and it falls out, and
you start gaining weight. You start losing libido.
Yes, sex drive goes in the toilet, and you don't want to have sex with your husband, and then he feels rejected. And then the bone loss continues. So now we've got to add. So now you've had your Prozac. So now we're going to add, one of the medicines, the bisphosphonates. Here's your Boniva. Take that. And we keep adding these things. And now you're a little bit heavier. So we're going to give you some diabetes medication and maybe some blood pressure medicine. And here we are, 10 years into this. Now you're 60, and you're on 5 different medications. You're 20 pounds overweight, and you're fat, hot, and crazy. You're less crazy thanks to your Prozac, and but you're still hot and fat. But unhappy and unfulfilled, and it looks like some women seem to be figuring this thing out. And everyone goes through menopause differently. Mine was actually not that bad because it was so. But I've certainly seen people that have just really struggled, because I didn't have much perimenopause. It was just high gun. But the menopause itself, I got on estrogen right away. My breast surgeon said it was okay, and that was because I was pretty radical with my breast treatment. I had a full mastectomy for a very low-grade tumor, and because I knew that I wanted my estrogen, because I feel like that it's really important, particularly for me. And when I went back for my 5-year follow-up, where they released me, which felt really weird, but I asked them, and I said, do you guys still believe that estrogen causes breast cancer? And she said, no, we now know that it doesn't. And then she also did say, she goes, well, some of our older male colleagues still believe that, but they'll come around.
Indoctrination. That's
right,
what
because, and we were talking about this, that, I don't know what the phrase is, but when you first learn something, that's the gospel, right? That's how it really is. And then any data coming in after that, you're like skeptical of, because you think, well, that's not the way I was trained. Yeah, right. And so then so this has been a revelation for us, like learning these things, especially reading some of these really old studies from 30, 40, 50 years ago that were really good, but we didn't hear about them because they just kind of got buried.
That was something that was fascinating about the use of desiccated thyroid. Before the Synthroid or levothyroxine became available, the doctor who was treating patients for 40, 50 years and kept meticulous records, he didn't have lab tests. He just would go based on the patient's symptoms, would titrate their dose, check their pulse, and if their pulse was okay and they weren't jittery and shaky,
that was your dose.
That was your dose. And his data was so good that they actually put his data into the Framingham Heart Study kind of algorithm, and they were predicting that he was supposed to have like 84 or 86 deaths per 100,000, and his was only like 4.
Yeah.
And the severity of disease was dramatically lower than what it was expected or predicted based on the Framingham study. So it was like, whoa.
And why did we never hear about this?
Because of Synthroid.
Because Synthroid came out very soon after his data was published. And so, you know, things we used to know, right? These are all things we used to know. And Hippocrates, talking about used to know, Hippocrates famously said, from Hippocrates of the Hippocratic Oath, famously said, all disease begins in the gut. And, you know, our ancient peoples knew this, the Druids knew this, the wise woman in the edge of the village in medieval times, they all knew this stuff too. They didn't have a way to measure it or anything, but they knew it. And we have forgotten it and are sort of rediscovering this now. Everybody talks about the gut biome and the gut-brain connection because it's very real. You know, your gut biome, the bacteria in there make 90% of your serotonin. So I'd want to be happy. I'd want to be nice to those bacteria. They're there to save my life, literally. And, you know, the way that, particularly in America, the highly processed foods that we have.
Don't even get me started.
Right, make it really, really, yes. He grew up in Spain, so he had real food for the first half of his life. But, you know, and it's not just the farming industry, it's also the soil here in North America. Is just not as enriched with